Well, thanks for joining us for KIMT News 3 at 10. I'm Katie Lang.
And I'm George Mallet.
First tonight, there are unpleasant side effects, fatigue, difficulty breathing, and persistent pain, sometimes lasting longer than 6 months.
Post-COVID syndrome has perplexed medical experts since the beginning of this pandemic, but now researchers at Mayo Clinic are coming together to find help for so-called long haulers, COVID patients who continue feeling symptoms after testing negative for coronavirus. KIMT News 3's Anthony Monzon live outside the Gonda building tonight. Anthony, what have you learned?
Well, Katie and George, I'm here at St. Mary's Hospital where some of the most serious coronavirus cases in our region pass through the doors of the ICU. Now, some of them will leave with a negative coronavirus test, but still feeling some long-lasting symptoms of the virus. Now, Mayo Clinic is convening a team of medical experts and technology, artificial intelligence to be specific, to try to get to the bottom of what's causing what they're calling post-COVID syndrome. Now, starting next Monday, a team of physicians with several different specialties will begin working with patients battling post-COVID syndrome, checking their symptoms and introducing different therapies. Doctors will then take the information they've gathered from their patients and feed it into an algorithm designed to identify trends and abnormalities. And as researchers see more patients, that algorithm will continue refining itself, and at some point, experts hope it will begin accurately predicting who may develop post-COVID syndrome and the best ways to treat it.
This will be one of the few times that we have a brand new disease that there's no data to build this model on, and we will see that model evolve in real time. A lot of times when things come to market, they're working off a database of 6 million diabetes patients, for example.
And this team of researchers has really already started doing in-depth analyses of post-COVID syndrome, including trying to come up with an exact definition of what post-COVID syndrome is, which has proven elusive to researchers.
Hey, Anthony, you mentioned these experts have already started research on post-COVID syndrome. Have they shared any of their initial findings with you?
They have, and those will be some of the key questions they'll hope to answer off the bat as well. One of them includes why this seems to be occurring more in women than men. Another question they'll be looking to answer is also why it's seeming to affect young people more frequently than they originally thought possible. Katie, George?
Thank you, Anthony. Dr. Ganesh says between 10 and 15% of people who contract coronavirus develop this post-COVID symptoms.